All right, listen, we got to get right into this. We have, what is it, 5 questions, Dr. Crystal?
Yes,
Like 5 big questions. These questions are what people are asking on Google, all the big social networks, what have you, about men, supplements, men health. And I'm going to start with number 1. Ready?
Yes.
What are the top weight loss and fat burning supplements for men? Dr. Crystal, teach us.
All right. And women want to know this too. So I'm just men, I know it's about you, but hey, we all want this answer. Testosterone. I'll just put it out there. Testosterone can really turn you into a fat burning machine. And the reason we want, and not just testosterone, DHEA, which is a precursor to testosterone, as well as 7-keto DHEA, which is, it's a metabolite of DHEA. And, we can get into some of those details, but really these nutrients can help to boost your metabolism. They help to increase your lean tissue, lean muscle mass.
That's big. That's big. So testosterone is the main, but by the way, there's no man, female, or woman hormones. We all have testosterone. Just men have it in a larger amount. Our body uses it more. So testosterone is that hormone that drives muscle mass and what have you. DHEA is a hormone you can take, which is a supplement. You don't need a prescription.
Right.
So you can buy DHEA over the counter. And that hormone turns into testosterone for a lot of men. And then 7-keto is kind of like the fat burning furnace version of DHEA. Did you like that?
Yes, I like that.
I totally just came up with that in a live show. That's great. Fat burning furnace is 7-keto DHEA. So that's really cool. So testosterone is a prescription. The other two, you can buy it at your favorite health food store.
Yes, and I always say test and replace, and that goes for testosterone. So test stands for testing, lab testing. Find out where you are, and we're not saying. I know testosterone in some instances has gotten a kind of a bad rap that it's only for the people who are trying to build muscle in the gym, and we think about roid rage and everything like that, but testosterone isn't, we consider it an anti-aging hormone. Levels decline as you get older, and you can replace it and keep your testosterone levels in a safe range. We call it physiological range.
Yeah. It's not, we're not talking about doing hormones to this point where you're like, it's about just reaching an optimal level. By the way, the level we look at is when you were like in your early 20s or so, right?
Yes.
It's just like when you were in your early 20s, or let me personalize this. When I was in my early 20s, I looked pretty good, Dr. Chris. I know things have changed. I know. That's okay. I'm okay with that. I really am. But when I was in my early 20s, I had a certain testosterone and DHEA range that my body liked. And all we're saying is we kind of know that for the average guy. Yeah. So we're just trying to get you up to that early 20, mid 20 range, right? Yeah.
Yep. And it's going to help with fat burning, weight management, blood sugar management. Yeah. You're wondering, as I get older, I'm having a hard time managing my blood sugar. That's where the testosterone can come in.
Yeah, that's good. Hey, what about a lot of guys are probably interested in HGH, human growth hormone. Like, what about that? What's your advice there?
The people that I know that have used HGH, and just one, it is a prescription. You're not really going to get your insurance to cover it, so you usually have to pay out of pocket, but it works for many people. It works to increase lean tissue. It also helps with healing. Someone that I spoke to that had a hip replacement, and their doctor prescribed them HGH, and they felt like, you know, their recovery was much faster.
That's
You
a
know,
good
versus,
point.
yeah.
I like that. Listen, I have an opinion about HGH, and here it's very simple. When you're younger, it's about growth. It's
Mm-hmm.
about building. It's not just muscle either. It's bones, it's joint. I mean, HGH is involved with all that. But when you're older, like in my age group, it's more about healing. It's more about keeping tissues healthy. And so
Yes.
there is some research that shows HGH could be something for you, but you got to talk to your doctor, right? At the end of the day, that's a discussion between you and your doctor. There is controversy about it. There's no doubt.
Very much so.
But the research looks pretty good overall, like you said, for the lean muscle tissue, right?
Yes.
Low T or low testosterone, what's happening there, why that's important. I mean, obviously, Dr. Crystal, I mean, testosterone is the main androgen, right? It's the main hormone for men and women in terms of building up muscle, that kind of stuff. But for men, it's what drives us. I mean, that's true.
Right.
Tell us a little bit about what happens to testosterone levels as we age, you know, from your 20s, 30s, 40s, 50s, and so on.
Well, you know, what kind of drove this focus towards low T was a study that really showed 1 in every 4 men over the age of 30 had low testosterone. And that's a lot of people out there. Now, all of those men didn't necessarily have any type of clinical presentation that they would recognize as low testosterone. You know, they didn't necessarily feel bad. But when you start thinking about what happens as you age, really what's happening is that your body is kind of shuttling its testosterone over into estrogen as you get older. And everyone knows about menopause, but no one talks about andropause.
Yeah. I think I told you this. I did that lecture once. I called it the feminization of men, as testosterone converts more into estrogen. We do. We tend to build up fat around our hips more, around our breasts, that kind of stuff. But so let's back up for a sec. So ultimately, testosterone levels drop. Total testosterone. You can even break that down into what's called free testosterone. But at the end of the day, we don't make as much, and then what we do make tends to convert into estrogen more. And that's kind of the picture that we have. So, you know, following your hormones, knowing your baseline steroid hormones, I think is really important, you know, at least when you get in your 40s and 50s.
Actual testosterone is a prescription, is a Schedule 3 drug. You have to have, you know, a DEA number to even prescribe it as a doctor. But you can work with the hormones that the body naturally makes. So as Dr. Mike mentioned, as you get older, your testosterone starts converting into estrogen. So what you can do is take a nutrient, something like chrysin, for example, or even zinc, and it stops that testosterone from converting into estrogen. So if you're stopping it from trickling down this pathway, then you're naturally helping to boost what the body is producing.
Yeah, I actually think that's a really good option for, you mentioned that we start seeing issues with the decrease in testosterone in our 30s, right? I think those aromatase inhibitors, those nutrients you just mentioned that block that convert, I think those are good options for younger men. I do.
I agree.
I think a lot of guys,
like your option, the best option is based on lab testing.
For sure.
I can't emphasize that enough.
For sure. But those aromatase inhibitors are really good options to keep that estrogen down, keep your free testosterone up, and that can be very helpful. Now, as you get a little older, right? I mean, you may start losing production of testosterone as well, and that's where maybe we have to consider some other things. I like DHEA. I think DHEA is a good place for a lot of guys to start as well. DHEA it's over the counter, right?
Yes, and we have a pathway where we can just kind of show you the visual of how the DHEA can kind of convert
Yeah,
into.
let's show that, Robson. So explain that slide for us, Dr. Crystal.
So this is the DHEA. This is available as a dietary supplement, but the DHEA that we naturally make in our bodies, you can see it converts to testosterone. It also converts into estrogen. And what you see on the screen in the smaller print, the aromatase, and then you see 5-alpha reductase, those are enzymes that's involved with helping to assist with the conversion of those hormones. So DHEA is a great option because we know it can increase or convert to testosterone, but you see, you have to make sure you are taking something to stop it from converting into estrogen. Something else to consider is that testosterone can then convert into dihydrotestosterone. So you want to consider nutrients that is kind of limiting that conversion down to DHT. So if you're stopping testosterone from going in those other paths, you can naturally kind of zoom in and support the testosterone itself.
Right. The main thing we wanted to talk about with the audience today was that pumpkin seeds have a pretty dramatic positive effect on the prostate for men. Tell us about some recent research.
Yes, and we actually have a study, Dr. Mike. I sent this over to you, and I was just
Good.
blown away
It's a good study.
So Robson's putting that up. It's a study that was just published last week, October 19th, hot off the press.
Hot off the press. We like that.
Yes.
Yeah.
Pumpkin seed oil versus tamsulosin. I always have trouble saying that word, but it's a type of medication that's often prescribed to men.
It's an alpha blocker. You have beta blockers, alpha blockers, all that kind of stuff. And the alpha blockers tend to be more in the urinary system, and by blocking that it does. It's a pretty effective standard of care for enlarged prostate. So they're comparing pumpkin seeds to what's kind of the standard.
Exactly. And that's helping the muscles around the urethra relax, which is going to help with urine stream and urine flow for someone who's dealing with BPH. But the research, it's just fantastic. 73 patients, they divided them in half as much as they possibly could. And so they measured the International Prostate Symptom Score, which is a survey of their symptoms. And they saw a significant decrease in the symptoms, significant improvement in quality of life in both groups. Obviously, the medication, we know that works, but we're comparing. I love studies like this where you compare the nutrient to an active treatment. It's not like we're comparing it to the placebo. Both groups are getting something that we hope will work, and we can see them head to head. And what stands out with this study is, yes, they both worked. The drug worked a little bit better, but they both showed significant improvements. And the nice part is none of the patients in the pumpkin group experienced side effects.
Yeah. That's the big thing, right? The alpha blockers, well known to help with urinary issues, prostate issues, as you can see on the slide there. But they are well known for common side effects of like dizziness, itchiness, headache. Those are very common complaints when you take alpha blockers. And guess what? The pumpkin seeds didn't have any of that.
Yes.
So that's pretty good. And we're always happy to see something in nature that's very safe, but yet effective, especially against a common treatment. Thank you for watching, everyone. We love it. Don't forget, we go live every Wednesday. So like, share, let your friends know. I'm Dr. Mike, and that's Dr. Crystal. I always do the wrong way right there. Thanks for watching. Until next time, take care.